Hi, Carly. Welcome back to the Healing After Infant Loss YouTube channel. Thank you so much for coming back because last time you were here, we were talking all about microplastics and how they are in our daily life. But today, I would love to talk to you about tests and treatments that people can do if they are experiencing recurrent pregnancy loss and also recurrent implantation failure. So, thank you so much for being here today.
Thanks for having me back. I appreciate it.
So when we were planning this, you sent me a big old email with lots of things, and I have no idea what any of it is. So I'm so excited to learn from you because honestly, as somebody who has gone through not infertility, but I've gone through pregnancy losses. I think when you go to the doctors, you kind of expect them to do all the testing and to know everything that they're supposed to be doing. And as somebody who has no idea, like I'm not a fertility expert, you go there and you kind of think, okay, is there anything I can test for? And they'll say, yeah, we'll test A, B, C. And you sort of go, great, you're the doctor, I trust you, let's do that. Whereas I think this is going to be a really valuable video for people who might want to actually advocate for themselves and have a list of tests that they can go to their doctor with, or at least do some research and know what to look for, because it can be hard to know what to do when it's not your speciality and you have no idea. So yeah, super excited to dive in. The first thing you talked about was microbiome. So first of all, what is the microbiome?
So you have different microbiomes in your body. I think the biggest one that people always think about or always know is like your gut microbiome. Like
Yeah.
everyone hears about like the bacteria in your gut, right? But you also have your vaginal microbiome and
Okay.
your endometrial microbiome.
Okay.
So with your microbiome, it's basically like in the simplest terms, your bacteria has to be balanced and you have to make sure that you have the right bacteria. So there has to be enough good bacteria as opposed to bad bacteria. When that gets off balance, that's when issues happen. So if you think of something like bacterial vaginosis, okay, your bacteria is definitely off with that. You have an infection. When it's out of whack, the doctors, they like to use the term dysbiosis is what they call it.
Okay.
So there's not always symptoms associated with this. So sometimes people are walking around for, months, years, and their microbiome is off and they don't even know it. And there's simple non-invasive tests you can do. There's quite a few for vaginal microbiome because they're just like swabs, and there's like
Okay.
at-home kits you can do. But when it comes to the endometrial microbiome, there's not a ton of testing for that. The tests usually involve biopsies, but there is one company that's doing a really amazing test that is non-invasive, and they're, I think, the only company that actually tests your menstrual blood. And with that, they're getting like the actual tissue and the blood and everything from inside the
Okay.
uterus, and that's how they're able to test it. And I would love to tell people about that test because it's amazing and you don't need a doctor to order it.
Okay. Before we get into the tests, how does the microbiome then? Because obviously, gut microbiome, we know that that might cause tummy issues with your poop and whatever else. So, how can microbiome affect fertility in terms of? I guess it's obviously. I mean, does the gut microbiome affect fertility, or
Oh,
is it
well,
just
yeah,
one and
yeah. Like your microbiomes need to be in line. Your gut microbiome, like in general, it affects everything. It can have an impact on your hormones. It can have an impact on your immune system. Like everything. Your gut is so important for your health. So if you're a person who's like generally like feeling unwell, like not having great bowel movements, great digestion, even like mental health stuff, integrating naturopathy into your life and like maybe seeing naturopaths for some extra testing, functional medicine doctors that really start digging into the gut microbiome, and there's tests you can do to help. Like that's a good step for everyone just in regard to your health, because a lot of stuff leads back to your gut, especially if you're having like leaky gut and stuff. But in regard to microbiome, like particularly for the endometrial microbiome, like if you have like a lot of like inflammation, like
Mhm.
chronic endometriitis going on, you're going to have things like recurrent implantation failures, not getting pregnant, recurrent pregnancy loss. So this testing is like recommended for people who have like unexplained infertility, recurrent loss,
Mhm.
recurrent implantation failure, because either nothing's happening or something's trying to happen and it's just not fully taking, because your uterine environment is almost like a hostile environment. Like it just, if you
Mm.
have an immune issue, it's like in attack mode, right? If there's all this inflammation in there, nothing is going to happen. And sometimes like the treatment can be as simple as, oh, you need to take this round of antibiotics and these probiotics. Like that's it sometimes.
Okay. And then can people test for this at home, you said? Or
Yeah.
is it best to go to the doctor first and then if they're not going to do it, then do it the home thing? Or is it just the home thing? Or like, how can people find out about this?
So there's only certain doctors that are really getting into the microbiome stuff. So this isn't something that every doctor is into or fully understand. I think we need more information about it. And that's why like a lot of women are taking this into their own hands and they're ordering it themselves.
Okay.
So my favorite one is called Fertilisis. They have an entire website. They're a company out of Greece. As far as I know, they ship worldwide. And this is a test you can do at home. So it's very comprehensive uterine and vaginal microbiome analysis. So like I was saying before, it assesses both environments for a full reproductive health picture. It's non-invasive because it uses menstrual blood and vaginal swabs instead of biopsies. So instead
Yeah.
of having to go to your doctor, have a bunch of like, recurrent losses or recurrent implantation failures, and then finally saying, okay, let's get you on a list for a biopsy. Then you have to do a mock cycle. Then you have to do a biopsy and wait for the results. You can order this kit at home, go through a cycle, do your swabs, collect your menstrual blood, and send it. It has advanced pathogen detection. It screens for over 25 different bacteria, fungi,
Wow.
and viruses linked to implantation failure. It does a lactobacillus balance check. So lactobacillus is the good bacteria that you
Okay.
need to make sure you have enough good bacteria. So it identifies the good bacteria versus the harmful bacteria, and that can affect your uterine health. And then what's great about this too is not only does it list like all the bacteria and everything and like what's going on and it tells you what's wrong, but it also gives you personalized treatment guidance. So it'll give you recommendations. So it'll say, you should take
Mm.
these antibiotics or probiotics, or if it's detecting other things, it'll give other interventions as needed. So you can take this to your doctor and you can say,
Yeah.
I did this test. Will you treat me? If they won't treat you, contact concierge at myStoria, and I can probably hook you up with some resources, particularly if you're in Canada or the US. Um, or just like message me on Instagram and I can help guide you as well. I always want to help people with resources and what they need to do. And, you can always like find a doctor that will help you and treat you for this and then go back to your other doctor if you need to. And then, this testing is really optimized for implantation. So it improves embryo receptivity and fertility outcomes. Like if you're able to treat these things, you're going to have a better chance.
Yeah.
There are other biopsies too that you can do, which I feel like more clinics tend to offer. But, some people are at home, having losses. Some people aren't doing the IVF route. So you're kind of like in this middle ground and it's like you don't always, I find like they're doing the biopsies on a lot of people who are on the IVF train, but like not everyone's on that train. So I don't know, do you want me to like talk a little bit about what those biopsies are for
Yeah.
microbiome?
But one second, that's a really good point because I had a miscarriage when I was in Cuba. So there was no way that I could have like held whatever came out of me for like a week and then go into a doctor's and be like, hi, here's a week old like tissue sample that I've just been carting around Cuba with me. Like you said, it's
Yeah.
just not really feasible for a lot of people because you're not at home, you're away, you're this, that, and the other. So yeah, that totally makes sense. But yeah, go into what you were going to say.
So there's a couple biopsies you can get done as well. So one is called the EMMA test. So EMMA,
Mhm.
EMMA, and that stands for endometrial microbiome metagenomic analysis. So what this does is it evaluates the endometrial microbiome to determine if the bacterial environment is conducive to embryo implantation. So a similar idea.
Mhm.
It again checks the proportion of good bacteria to bad bacteria. So good bacteria obviously is associated with higher pregnancy rates. So they take some endometrial tissue via biopsy and then they analyze it to identify these bacteria and the imbalances in the endometrial microbiome, such as like low lactobacillus levels, has been linked to implantation failure and infertility. So same idea, just sort of like a different method of obtaining that endometrial tissue. So way more invasive and it's painful. Like some women, have totally done it, but they're like, if I had to do it again, I would try doing something different because it's not comfortable. But if it's a good test, like if that's what you have available and it's better for you and that's what your doctor wants to do more, then go for it. You have options, right? The ALICE test, so that's analysis of infectious chronic endometritis. So it detects pathogenic bacteria responsible for chronic endometritis. So that's like persistent inflammation of the endometrial lining, and it can identify those bacteria. And those are also associated with like recurrent implantation failure and recurrent miscarriage as well. So again, takes that sample via biopsy, and it often chronic endometriitis, like it often presents without noticeable symptoms. As I was saying earlier, people are walking around, they don't know they have these things, right?
Yeah.
But it significantly affects your fertility outcomes. And again, same treatments, like usually a combination of antibiotics and probiotics. Sometimes depending on what's identified, they may have to like prescribe antifungals, things like that.
Mm.
And then it usually restores balance and improves outcomes.
Okay, this is a bit of a beginner question. What is endometrial tissue? I think you said. Is that period stuff, basically, in
Like your
layman's terms?
uterine lining that
Okay,
you shed every month.
okay. Because I've heard of endometriosis. I need to interview someone about that because I don't honestly know enough about it. So endometrial tissue is the lining that you shed when you have your period. Okay.
Yeah.
So there's certain tests. So there's certain tests that would be when you're not having your period, and then certain tests where you collect the blood and the tissues and things, and that's what you would test for. And then
Yeah.
the okay,
Yeah, they do. Biopsies are done like not when you're on your period, but the fertility testing, there's two portions. When you're on your period, you have to collect a certain amount of the menstrual blood.
okay,
And they give specific instructions on like when to do that. And then when you're like not bleeding, then you do a vaginal swab and then you send it and then they'll give you the results. Yeah,
okay,
endometriosis is it's different than this like
yeah,
endometriosis. There's a different biopsy you can do for that, which again, like some doctors it's controversial. Really, laparoscopy is the best way to fully identify and stage endometriosis, because it can get into other tissues like outside of your uterus and get to your ovaries, your bowels, your bladder. They found it in lungs, brain.
yeah,
It causes what they call adhesions, which is like scarring
okay,
and inflammation in your uterus, ovaries. It can cause blockages and damage to your tubes, your ovaries. It affects your egg quantity, your egg quality. You could definitely do like a whole hour long segment
yeah,
on endometriosis, which is great because it takes like on right now it's like a 7 to 10 year diagnosis, which is absolutely ridiculous. And there
wow,
is certain fertility treatment that should and shouldn't be done for people with endometriosis because certain things can end up making it worse and progressing it. And there's an immune response involved with that as well. And the body needs to be calmed down, for optimal
maybe we need to
success.
book a third call. All about endometriosis, or find someone else if you're sick of talking to me. But yeah, I need to learn more about that because I hear about it and I've heard it's like a full body thing and it's never taken
Yeah.
seriously enough and people really, really suffer with it. But I'd love to know more about that. Yeah.
Yeah, for sure. Yeah, that's definitely a good conversation that we can have. Or if you find like somebody else that's an expert in endometriosis, hey, whatever floats your boat, I'll talk with them too.
So, is there anything else you want to say about the microbiome for people that are watching that maybe, is there anything else you want to add to that section?
Like I think we covered, the basics. Some naturopaths, if you're working with them, they'll recommend at-home kits, but they may be more related to just the vaginal microbiome. I think if you're gonna do it, and you're gonna do a home test, like I vote for Fertility every time because it's so comprehensive. If you have like your vaginal microbiome is in dysbiosis and you fix that, it's like, well, what about what's going on? What if you still have chronic endometriitis? So I'd say if you can test both, test both.
Yeah. Okay. The next one you sent me is autoimmune conditions.
Autoimmune conditions, people can live with them for years and not know they have them. They're hard to diagnose because oftentimes people have like a bunch of little systems and different
Mm,
systems of their body, and they're only reporting certain things to certain doctors. So it's very fragmented. And you kind of have to
okay.
have like a big picture look there. So it's an immune response to certain things. There's a lot of inflammation involved with autoimmune. Like you could do a whole podcast just on autoimmune disorders, but to give some
Okay.
examples so people kind of like know, like
Yeah.
when I'm talking like autoimmune, like lupus,
Okay.
Rheumatoid arthritis. Those are like really common autoimmune disorders, but like diabetes, especially type 1 diabetes, that's an
Mm.
autoimmune disorder. Like Hashimoto's for your thyroid, that's an autoimmune disorder. With that, it's like your body starts attacking like its own thyroid tissues, like in the simplest terms. It's like attacking its
Okay.
own thyroid. Your immune system is confused. It doesn't understand, and it's like attacking itself or its own tissues. So like this is what happens with endometriosis, right? Is like your system gets so flared up that you try to put an embryo in there and your body can't even recognize that
Mm.
that is embryo tissue, not endometriosis tissue. So it attacks, and it's like your body's
Ah,
attacking your own tissues, and then you're making this scarring and these adhesions inside your body.
wow.
So with that, your body gets really flared up, and it's usually in some kind of like attack mode, which makes it really hard to get pregnant, particularly when you're in a flare up
Yeah.
state. So with
So,
autoimmune testing, go ahead.
no, I was going to say, so what are the sort of tests that people can do for the autoimmune conditions? Are these at home or are these at the doctors? Are these doctors, hospitals? What's going on with the autoimmune conditions?
So with autoimmune testing, like a lot of it is going to be blood work. I say the bulk of it that you should like get ordered from your doctor. I'd say like if you're having recurrent pregnancy loss, you definitely need to get some blood work ordered for sure. There is definitely certain blood work that they need to order. So like really digging into like autoimmune factors. So even if your thyroid looks more normal, I'd say get a full thyroid panel done and make sure they test your thyroid antibodies. You
Mm.
could have a normal TSH level, but your thyroid antibodies can still be off, which is kind of like a precursor of like what's
Mm.
coming. It's like something's going on there. Test for antiphospholipid syndrome, so antiphospholipid antibody syndrome. So then this is APS. So this is like a whole range of testing that you can get done. And this antiphospholipid antibody syndrome, this is an autoimmune disorder. So where the immune system mistakenly produces antibodies against proteins bound to phospholipids. And phospholipids are components of like your cell membranes. So
Okay.
this increases the risk of abnormal blood clot formation in your arteries and veins. So could you have like a clotting disorder, right?
Mm.
So if you
Okay.
have increased clotting, this can lead to blood clots causing like stroke, deep vein thrombosis, or other clot related conditions. It causes pregnancy complications, so associated with
Mm.
recurrent pregnancy loss, preterm deliveries, conditions like preeclampsia, because like the blood flow to the placenta is not good. And there's like different kinds. So you can have like primary versus secondary APS. So does it occur on its own? Or is it alongside another autoimmune condition such as like lupus? So usually the blood tests are what diagnose it, and because it can test for these antibodies, just like the thyroid antibodies. This is how you test. You start testing for antibodies to
Mm-hmm.
for certain conditions to see if your body's developed these antibodies against it, right? And then they'll usually put you on blood thinners for this, so low dose aspirin or heparin, like low molecular heparin, is a big one. Like Lovenox, they'll use a lot in fertility protocols. So tests for this, like blood tests, and I said I'll send you this list after. But like you're
Yeah.
testing in this for like lupus, anticoagulant, like activated partial thromboplastin time, so dilute Russell and Viper venom tests. Like there's all these like little tiny like tests. And it's like a huge panel. Anti-cardolipin antibodies are like a huge one. Factor five. So that's like a gene mutation that people can have. Other
Never
gene
heard of that.
mutations. There's like a huge list that you're gonna be like, whatever, Carly. But I can send you that huge list,
Yes.
and they'll know, like the doctor, like if you just said I need to be tested for like do a clotting and thrombophilia panel, or I need an APS panel done. A lot of times doctors with recurrent loss, like especially for like the APS panel, they'll order it as well. And then what you want to get is like other autoimmune and inflammatory markers tested. So anti-nuclear antibodies are one. And if those are positive, that's like, okay, like, it can be associated, with things like lupus, rheumatoid arthritis, things like that. So if those are like positive, then they'll start being like, okay, we need to run other like specific markers
Mm-hmm.
to start figuring out what it is.
Yeah.
There is a specific test for rheumatoid factor as well. Also, C-reactive protein is a great test because that kind of tests for like, it's a good test for like inflammation and can be associated with other things. So that's a
Okay.
really good test to do as well. So those are like some major ones that I'd say that people need to test for when it comes to like autoimmune stuff.
Are these, this is probably a question for the end, but are these the sort of tests that doctors do routinely check? Or is this something where you have to know your shit and you have to be like, I want this doing, here's a list of tests I need doing? Or is it something that doctors do tend to sort of ask questions about? I mean, obviously it depends on the doctor, but are a lot of these things sort of going unmissed and unnoticed and sort of tested?
I think it really depends on the doctor. If you're at a good fertility clinic, I mean, they're gonna run an APS panel, but some doctors wait longer than others. If in my experience, like if a person has like two losses, they're gonna and coming into a fertility clinic and they're like, oh, I've had two losses at home. Like the doctor's gonna run this stuff. But I've seen other people where the doctor's like, no, you have to have three or four losses. And
Yeah.
what? Are you kidding me? And if you're not at a fertility clinic or like working with a doctor who's well versed in recurrent pregnancy loss, then they just might not know this stuff. Like in general, they don't even know what fertility tests to run
Yeah.
either. So, I mean, it really can depend on your doctor. So sometimes it's good to advocate and say, well, I looked this up. Can we run these tests, And like depending on your coverage, your insurance, like some people also like are limited in what they can and can't do. Like access to care is a really big issue right now. But I
Mm.
mean, if you're willing to pay and it's your body, I don't
Yeah.
understand why you should be denied access to care. And sometimes it's about, okay, can I find a different practitioner, somebody who's going to help me? It's frustrating to have to do that, but unfortunately, like that's the world we're living in
Yeah.
sometimes. I've seen other doctors who are like amazing if somebody, things are looking good and they're going through an IVF cycle and everything looked amazing and their embryos looked great and they had a nice, good graded euploid embryo and the transfer didn't work. Sometimes those doctors right away will run the
Mm.
antiphospholipid antibody syndrome. Like they'll run that panel because they'll be like,
Mm.
this is weird. Why didn't it take? Everything looked good. Is something else going on that we're missing? And they'll just do it right away,
Yeah.
but not every doctor's like that.
Yeah. You said about the recurrent loss thing. So I had a miscarriage and I had to have a late term abortion, like a termination for medical reasons, and then two other miscarriages. And I remember I went to the doctors in England and they were like, well, you need to wait until you have three miscarriages. And I was like, I have. And they were like, no, they have to be three back to back. And I was like, how
No.
many times does someone have to go through loss in order to be taken seriously and have these tests done? Because it's not like an easy, like, oh, just go and, drink a bottle of water and then come back again. Like going through, wanting to get pregnant, getting pregnant, losing that pregnancy is a huge thing that just isn't taken seriously enough. And, having to like prove yourself. I've definitely had three miscarriages,
Yeah.
even if you don't, because I also didn't go to the doctors for two of them. I didn't get any paperwork. Like I said, I was in Cuba for one of them. So like, I don't know. Yeah, it's kind of crazy that you have to go through a certain amount of loss before it's like, okay, now we'll help you. Now you've suffered enough, we'll help you. We'll do some testing. Like, it's kind of bananas to me.
Yeah. Well, it is bananas because when you said I'm in Cuba, I was in another country. This is what happened to me. I was pregnant, I had a miscarriage, and they're completely disregarding that.
Yeah,
That to me is just absolutely like wild and just like almost like medical gaslighting.
yeah,
You know
yeah,
what I mean? Like you're like, this happened to me. And they're like, no, 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 it didn't. You didn't have three. And you're like, are
yeah.
you kidding me right now? Like, no, I did. And somebody please help me. And it really does depend on where you live because here two losses. That's recurrent miscarriage. Like
Okay.
we don't wait till three or
Yeah.
more. The testing starts.
In the UK, they were a bit like, well, try and get pregnant again and try for a third, like, well, from this point, like a fifth, but like a third recurrent miscarriage, and then I did actually like sort of say to them, no, this is crazy. I've had three losses. Like, we're gonna have to do something. So I did get testing in the end. I have no idea what the testing was. And that was a couple of years ago, and I don't think even at the time I knew what they were testing for. But yeah, just the fact that you kind of you have to keep going through all these losses, and then it's like, okay, now we'll help you. Now you're at the point where you don't want to try again. Now we'll help you. It's like, great,
Yeah.
super
Yeah. Right
helpful.
when you're at the end of the rope. Yeah.
Yeah, yeah. So the next thing you sent me information about was sperm testing. Obviously, most people should know what sperm is and how sperm can affect embryos, fertilization, all the rest of it. But what are some of the testing that people can do for sperm that's additional that maybe isn't being looked at in the first place?
Yeah, so sperm, I mean, usually like step one is get the sperm tested, right? Do like general sperm analysis,
Mm-hmm.
and make sure things are looking good. If not, like there may be things that need to be addressed. Some things are like easier to fix. Your motility is a little bit low. Well, sperm regenerates, around every 72 days. So it's like, there's easy lifestyle changes that males can make that can really have like a great impact on their sperm. But sometimes what happens is, oh, sperm's looking good. This is great. And then it's like, well, everything else looks good. Now we're in unexplained infertility. And it's
Mm.
like, well, what's going on with DNA fragmentation? Sperm can seem normal and seem to be in okay parameters, but it can be fragmenting, like on the DNA level. And in that case, you're either not going to get pregnant or you can start having recurrent loss. So in cases like this, where you're having unexplained infertility, everything else looks good, or you're having recurrent pregnancy loss, DNA fragmentation should really be looked into. So what they do is like the male produces a sample and they use like a staining process and a microscope to see if there are any breaks, dents, chunks missing in the DNA. Everyone
Mm.
pictures that like double helix in your
Yeah,
mind.
yeah,
So it is one of the most discussed and promising biomarkers in basic and clinical andrology. And it's definitely like an important addition to the workup. So it's not always going to be something that they recommend right off the bat. But I'd
mm-hmm.
say if you fall into one of those categories, it should be something that can be looked at and something you can advocate for. Like if you want to do it and you're like, do you have DNA frag? Some people just want to get it done. Like I've heard stories of like males going through like regular testing, their partner going through testing, everything looking good, and them spending money on like several cycles. And the doctor being like, oh, maybe we can do DNA frag. And, the male being upset and being like, why didn't you just tell me this to begin with? I just would have done it right off the bat because the
Yeah,
fragmentation was really bad after. He's like, we just
mm.
wasted how much
Yeah,
money on cycles. So I really think that needs to be taken into consideration, when family planning, when doing testing. It's like, okay, this is the basic. What else do you have? Can I decide? Even though you as the doctor are saying like what you're supposed to say, this isn't recommended right now. But if I choose to spend the
mm.
money and want to do it, like I feel like people should have that power of choice.
Yes,
It frustrates me when they
absolutely.
don't. So usually like here, like in Canada, we have coverage. Usually it's like it is a private test. Like usually it's not covered
Mm.
by even like insurance all the time, or if you have like covered healthcare, this is something that's usually outside of that. DNA damage to the sperm can kind of be induced by like six different mechanisms. So, with something going on during the creation of the sperm that's
Mm-hmm.
like messing up the DNA, is it just like breaking during the like remodeling of the DNA? Is there like oxygen radicals, like post testicular DNA fragmentation caused by like oxygen radicals? Is it induced by like radiotherapy? Like, is it induced by chemotherapy? So has there been some kind of treatment or something that's like affected the
Mm.
DNA? Or is it like environmental toxins? So like air pollution, what's going on in your lifestyle that could be causing this? Like
Mm.
the oxidative stress, on like women's ovaries, on male testes, it does play a factor. So they usually give like the results for this in percentages. So
Okay.
if it's like the amount of fragmentation you're having in your DNA, if it's like 15% or less, it's good. It's amazing. It's great. If
Okay.
it's like 15 to 25% of your DNA is fragmenting, that's still good to fair. Like that's okay. If 25 to 50% of your DNA is fragmenting, that's when they're going to say, oh, it's like fair to poor, like depending on where it's falling. Like if,
Mm-hmm.
half of the DNA is fragmenting, that's not great. And if it's
Yeah.
like 50 to 100% of your DNA is fragmenting, that's like really poor. So if you're having like fair to poor results, like then there's obviously that's an issue that needs to be looked at.
And is that so? You
Like,
said that the sperm gets regenerated every, I can't remember what you said. So is that something
yeah.
that people can improve? So if they do have like
Hmm.
50, 60, 70%, can they then spend however long it would take to, I don't know, what could someone do to help their sperm DNA
Yeah. So, I
fragmentation?
mean, obviously, when it comes to sperm, it depends on the parameters and kind of how many are off, because some people could be having, more serious issues.
Mm-hmm.
So, there's like reproductive urologists that you can go and see. because especially like when your count is really low, like the count in sperm, if
Yeah.
you're, it's like, okay, the count's not looking good, the motility is not looking good, the morphology. So it's like there's not very many, they're not moving great, and the shape and stuff doesn't look good. And then like, are you fragmenting on top of that? In
Mm,
those cases when it's really not looking good, you should be, consulting like reproductive urologists. These people specialize in male fertility. There's
okay.
treatments that can be done. There's sometimes associated like imaging that needs to be done. Like, do you have a varicocele? Do you have some kind of blockage that's going on? Like, genetic testing. Like, if you have no sperm, like, is there a genetic problem and you've just lived your whole life
Mm,
and like didn't know it, right? There's so many
yeah.
things that can be dug into with that. But some general tips like for sperm health. So if you're not having to like fully get to that level, like where there's like a serious, like actual, like identifiable, like diagnosis, and you're like, oh, the sperm's just not looking great, so we need to do some lifestyle changes. There's
Hmm.
definitely like quite a few tips. So first tips for like sperm health: no testosterone replacement therapy. Do not take that if you're planning on having children. If a doctor recommends that to you, you need to have like a family planning conversation. And if you've ever taken it, you have to tell your
Mm,
doctor. Same with anabolic steroids. You have to tell them, because that could be like a huge reason on why your sperm isn't great. That stuff's like male birth control. It literally decreases your intratesticular sperm. And the longer you're on it, the longer it takes to
mm,
recover. And there could be a possibility of not recovering. And usually you need like assisted reproductive technologies when it comes to that. So, like I said, you have to tell a doctor if you've ever taken steroids or testosterone replacement therapy. Okay.
mhm.
Heat. Stay away from heat. Heat is the sperm killer. Stay away from saunas. Stay away from hot tubs, really hot showers, really hot baths. The underwear, it should not be like super like tight, or your pants like crushing, your body against itself, because your body's
Mm,
heat, like the testicles are outside of the body for
yeah.
a reason. Also, if the underwear is like too loose, and the testicles are like always like laying like fully like against the body all the time, like it gets hot in that
Mm,
area. So
yeah.
it needs to be cooled. So the underwear you have needs to like gently support and like hold them slightly like away from the body. If you feel like you're having like male factor fertility and like a lot of trouble with sperm, there is underwear. It's called Cool Beans. It was
Mm,
actually created by a couple in Australia. It is a registered medical device. You can get it online. They have like every size for like every person, depending on like their body, the pouch size they need, everything.
wow.
Um it's a very cool product, and I'd say, if fertility is a big factor for you and you're really trying to improve sperm quality, it's worth the money to get
Okay.
those.
Is
um
just one question. Is
yeah.
laptop on the lap, is that actually an issue? Because I see that all the time. Like, men, don't put your laptop on your area because it can cause XYZ because of the heat and whatever else.
Yes. Yeah. Keep
Okay.
like, yeah, anything hot off of your lap. Just keep it away. I mean, in regard to technology, there was a big thing with like phones in the pockets
Yeah.
before. I mean, I always think I'm against like wearing a lot of devices on my body anyways. Like, you'll never see me with one of those watches on. So I'm just like weird about that stuff anyways. I know it's better than it was, particularly with the phones, but I'd say anything you can do to keep any type of like electronics and heat away from that area is good.
Yeah. Okay.
Decrease cycling. Cycling a lot, it
Oh.
affects, like, just think of how you're sitting, like the position, the pressure on that
Yeah.
area. So you need to stop cycling. No smoking, no drinking, no vaping, no drugs. You need to do whatever you can to reduce inflammation. So sleep is huge just for everybody and for general health. When you sleep, that's when your inflammation decreases, hormones reset. Think about eating anti-inflammatory diets. So things like the Mediterranean diet, that diet's been studied so much. It's like tried and true. Like, decrease sugar, like avoid processed foods. You're trying to put like as little toxins into your
Yeah.
body because you're trying to reduce inflammation and decrease oxidative stress. BMI. Like, if you're overweight, that can be an issue, especially because people who are overweight tend to have like higher estrogen, so, and more inflammation and insulin resistance. It's a precursor for diabetes, so you just want to get that in check. Doing exercise but not overtraining. You don't want
Mm.
to go crazy and like overtrain. That goes for both like men and women in general. And then you need to like reduce endocrine disruptors and toxins in your life. So, start looking at like your environment and what's in there that could be affecting you. And this is like a ton of stuff that we talked about in the last podcast.
Yeah.
So just
We have a
moving to more
whole
natural
video talking
products.
all about
Yeah,
that. So go and watch the other video. I'll leave it linked below. But yeah, that was a really good conversation as well.
exactly. And take vitamins. My God, take vitamins. So
Mm,
for the males, like vitamins are so great. So like a really good one, like Bird and Bee, the Powers for Men. So it has a CoQ10 booster in it. Mitomodal is another one. I like those ones because they're nice little like sachets, so nice little
mhm.
packet, and it just has everything you need in it, and you can just take it. So much
Okay.
easier.
Gosh, you know so much. It's incredible.
I mean, I've been doing this for like a few years, so I'm always learning, and I always am asking other people to like,
Yeah.
patients that I've met, doctors, naturopaths, everybody. It's like, tell me, what's the newest research coming out? What have you done? What works for you? And just trying to like
Mm.
continuously gather as much information as I can to share it with as many people as I can.
Because there's always new studies and new tests and new information out there. So I'm pretty sure probably every year, every 6 months or something, there's new stuff that they're trying and testing and coming out with. So it's good that you're like staying on top of it all. I'm sure it's a lot to
Yeah, I
do
mean,
all this.
I'm trying. I'm trying. And sometimes we need that. We need those people that are like pushing the boundaries a little bit and
Yeah.
trying new things because it's a relatively young area of medicine, I would say, and it's it's hard to sometimes research and test these things because it's sort of like a sensitive thing. Like you are dealing with like the creation of life, right?
Yeah.
And so it's hard because the repercussions of
Yeah.
something like it could be dangerous, right? So, but we have a whole people that you're dealing with outliers here. Not everyone fits into like these little boxes.
Mm.
Some people it's like, oh, if you're having anovulation, that's the only issue. Okay, that's an easy fix. But what about other people who've been trying for years? It's like they don't fit into the old school protocols. It's like we need to try something different, and it needs to be a holistic approach of a combination of what can you do on your own to be as healthy as possible, and then how can you combine that with Western medicine? And even then, it's still frustrating and it doesn't always work. So we need to keep
Yeah.
pushing forward.
Is there anything else with the sperm testing that you want to talk about that maybe we didn't touch on, or was that everything you wanted to say?
Yeah, I think I'm good for talking about sperm. I think that's like the basics and the number one things I would say to start digging into.
Okay. So then you listed a load of treatments. I'm not even going to try and say any of them because they are such complicated words. I'm also dyslexic, so this is like I have no idea what any of this means. So talk to me about all of these treatments that people can take.
Okay. So when it comes to like immunology, that is sort of like the area where I feel like advanced treatments and other things sort of need to be looked at and need to be done. And this is the hard part because it really does depend on your doctor because not a lot of doctors are doing things. But if you're a person who's sort of at the end of your rope with maybe the area that you live in, nobody's doing this other things. Like sometimes it depends on like, you know, yourself, your partner, how far you're willing to go. And it's, are you willing to leave your area and
Mm,
go somewhere else to do what it takes and find a doctor that's going to do these extra things? Because it may be what you need. If you've tried everything else, it may be
mhm.
just a matter of picking up and being like, okay, this is what I'm going to do, and like I said, you contact me, check out myStoria, contact me on Instagram, and I can, try and put you in touch, with some people that are out there doing this stuff. So for immunology, these are treatments in this section are often recommended for like those that have like unexplained infertility, recurrent implantation failure, recurrent pregnancy loss. So
Mhm.
this is sort of like the group that may benefit, or like if you obviously have like a known autoimmune disease, a lot of
Yeah.
time like it's 80% of autoimmune diseases are experienced by women. So there's something
Oh.
called we call it LIT therapy. So that's lymphocyte immunization therapy. So this involves injecting the male partner's lymphocytes into the female partner, and this helps like modulate her immune response. So it
Mm.
aims to improve pregnancy outcomes in cases of recurrent miscarriage or unexplained infertility. Um,
Is that so? Is that because then the female body doesn't reject it as like foreign or something?
Exactly. Like that
Okay.
sometimes it's like that, is that what's occurring? Like, is there some
Mm.
kind of immune reaction?
Yeah.
to the partner. There is, I know we talked about fertility testing, and like I talk about it a lot more in terms of like microbiome, but they do other immune testing too. So that's like digging around on their website and getting
Mm.
curious and looking at what other different testing they get into, like alloimmunity, like a bunch of different stuff. So if you're interested in immune stuff, I'd say,
Mm.
and some testing that you can do on your own and take things into your own hands, fertility really is a great company.
Okay.
So that's one type of treatment that's being offered. And then there's something called endometrial immunomodulation, excuse me. So this kind of helps like adjust the immune environment to the uterus to improve implantation and pregnancy success. So
Mm-hmm.
a couple common treatments that fall into this category are what they call peripheral blood mononuclear cells. So this is when a person's own immune cells are collected like via blood draw. Then they
Mm-hmm.
cultivate them for about 48 hours into a special medium, and they're activated and they're infused into the uterus to promote implantation friendly environment. So that's something that can be done. And then PRP. So a lot of people have heard of PRP, platelet rich plasma. So they do this like, there's a whole other conversation about like ovarian rejuvenation that they use like this for, but in this case, they use it for the uterus, which is great. It's great for like help thickening the lining as well.
Mm.
So what they do, it's a treatment rich in growth factors and cytokines is introduced into the uterus to enhance endometrial receptivity. So they take the patient's own blood and they
Mm-hmm.
spin it in a centrifuge usually for about like 50 minutes, and they separate the plasma from all the blood. And this is like every time you go get blood drawn, like as a person, this is what happens. They take the blood out of your vein, they put it in this fancy little machine that basically spins it around really, really fast, and
Oh,
all the
okay.
red blood cells separate, and then you get this like clearish, like it's usually has like a yellow tinge to it, like
Mm.
fluid on the top called plasma. And that's really when you're getting your blood drawn. Like the tests usually come from the plasma. So they take that plasma
Okay.
and then they use it in various ways. So like I said, if they're doing like ovarian rejuvenation, they'll inject it right into the ovaries. But like in this case, like for like immune, what they do is they introduce it into the uterus, or they push it through the uterus down the fallopian tube in order to bathe the ovaries with plasma. So it can help, like I said, uterine thickening of the lining and receptivity. So helps lining, and it depends on when they do it as well. So there's different like
Mm.
time frames depending on what the goal is. Improves receptivity, and then if they're doing ovarian rejuvenation, it's egg quality and quality. But the research on that's a little like, I think it takes a very special patient to be a candidate for like ovarian rejuvenation. It's not for everyone, or you're not necessarily going to have a good outcome. So
Yeah.
that's a
Okay.
whole different conversation, I'd say, with like a doctor who specializes in that.
Yeah. Okay.
So again, like with these therapies, they're aiming to balance immune responses, improve embryo implantation, um, and they're promising, but the results, of course, can vary because it just depends on each person, and the research is still ongoing with this stuff. So again, some of these things can be considered controversial by some doctors. That's why they're just not into it. But when you're, done A, B, C, D, E, F, G, H,
Yeah.
like these other
Yeah.
things need to be considered. Intravenous immunoglobulin is one. So this is used to modulate the immune system. It's aiming to counteract like maternal antibodies that might attack a developing
Mm.
embryo.
Okay.
So this is an IV treatment. It's utilized in cases of recurrent pregnancy loss or repeated IVF failures. It improves IVF outcomes. It remains a subject of debate. Some studies suggesting benefits, while others like find insufficient evidence. There was a doctor out of Montreal before the pandemic, I believe, that was doing this. She works in immunology. I think her name is Genevieve Jeunesse, I believe her name is. And I watched a video, and they were having promising results. Like people, again, like were having like 5, 6 losses, like other things, other treatments weren't working. And they were having good success. But then because they need intravenous immunoglobulin for other like illnesses and other things in hospitals, I think they kind of shut it down a little bit and said, no, that can't be the first line treatment.
Mm.
So they couldn't do it as much as they wanted, as far as I know. And then I think now it can sometimes be used if people have tried like many of these other treatments. and
Yeah.
they're not working, other protocols, then it's like, okay, you may be a candidate for this, but this isn't as easy as it used to be, I don't think.
Okay.
There's intralipid therapy as well. So again, intralipid infusions, modulating the immune system. This is specifically targeting elevated natural killer cell activity, which has been associated with recurrent implantation failure and miscarriage. So it's another IV infusion. It's like a fat emulsion.
Okay.
So that they put in, and it's believed to suppress these overactive natural killer cells. And then it makes a more favorable environment for implantation. So again, studies mixed results regarding effectiveness. Some research indicates benefits and improving implantation and pregnancy rates, while other studies find no significant impact. So again, it's like they're always saying like more, we need more studies, we need more
Yeah.
studies. But then you find people, and I've talked to like nurses and doctors at clinics who do this, and they're like, this works great, and we see it work on like a lot of patients. Doesn't mean it's going to work on 100% of people 100% of the time, no. But like we're saying, if you tried everything else, like some of these things may be worth exploring
Yeah.
or
Yeah.
talking to somebody about. Sometimes it's a combination, like they're doing multiple of these things.
Okay.
I kind of mentioned this earlier, low molecular weight heparin. This is more common. This I definitely see more common. So this is an anticoagulant used to prevent blood clot formation. So they'll
Okay.
use this a lot of time with recurrent loss. It's very rare that I see someone that has recurrent loss that's not on at least like a low dose aspirin or this at
Okay.
some point, depending on what their protocol is and like what type of fertility treatment they're doing. So it and like obviously if you are known to have like thrombophilia, they're going to give you the low molecular weight heparin, so it's like Lovenox. So beyond like its natural anticoagulant properties, it's in thought to improve blood flow and help
Okay.
modulate immune responses. So again, creating a more receptive endometrial environment for implantation. So research has demonstrated that it can improve clinical pregnancy rates, implantation rates, live birth rates, while decreasing miscarriage rates in certain patient populations. So, but it has to be individualized, like all
Yeah.
treatment should. There are some like oral medications you can take. So corticosteroids. So this is things like prednisone. They suppress immune responses. They're prescribed in certain cases of suspected immune-related infertility. So it is debated, again, with concerns about potential side effects, limited evidence, but I've seen like quite a few doctors using this. There's also immunomodulating medications. So I have seen some doctors use these in multiple countries. Is everyone doing it? No.
Mm-hmm.
So immunosuppressive drugs, these are things like if you think about like preventing like organ rejection, they would use these medication like transplantation.
Okay.
Some common names that you might hear like tacrolimus, sirolimus, are names that you might hear like floating around the community. So in fertility treatment, the role centers around modulating the immune system. So we want to calm the immune system down, right?
Yeah.
Which can cause like recurrent implantation failure, recurrent pregnancy loss. It's like tacrolimus is explored in fertility treatment. It's an option. They use it a lot in like I said, recurrent implantation failure, recurrent pregnancy loss, that they're pretty certain like there's something autoimmune going on. Some studies are showing that the low dose tacrolimus might help improve implantation rates by reducing the immune mediated rejection of the embryo. So if you even think about like endometriosis, right? The immune
Yeah.
system's all flared up. Like I said, hostile uterine environment, you're trying to get the embryo in there and your system's like in attack mode.
Yeah. Yeah.
So, and that people will often like start taking these like before they start cycling to
Okay.
try and like calm the immune system down.
Yeah.
And then whether they know that they continue, I mean, that's going to be up to the doctor. The other medication, sirolimus, it's like a similar type medication. I feel like the other one is like a little bit more common, but again, like modulating the uterine environment and immune responses. These things, like I said, they're controversial because they're off label for fertility purposes. So, doctors like tend to either not use them if they're not necessarily well versed in reproductive immunology, but for patients with specific immunological challenges affecting implantation or early pregnancy, this like can be a good treatment, but they need more studies. But also, like if you have a known condition and you have an immunologist on your own, like that doctor may be able to prescribe you something, right, to calm your system, and then you might be able to
Mm,
be like utilizing multiple providers together. It just depends on what your known diagnosis are. Like a lot of times when people are having, like I said, like 5, 6 losses, it's really like a strong suspicion. This person probably
yeah.
has an autoimmune condition. It's going undiagnosed. There are other providers, like you can't have like your REI start like treating your entire like lupus condition, right? If you
Yeah.
have it. So it's like, are you sitting waiting for referrals? So it depends on each person and where they are in their journey. Some doctors will be like, hey, I'm suspecting this, or you've got some endo, some of these drugs are going to help calm your immune system, and they might create protocols. Other people who have known autoimmune issues, they've been living with them for years, they're going to have a whole care team, right? Where they have like multiple doctors coming together. And it's very important, if you're having like living with a chronic illness, that your whole care team is like on the same page and knows what's going on, and that you're not trying to cycle or do things in the middle of a flare up.
Yeah.
Yeah. And there's other
Gosh.
little things you can do, like HCG wash. So they'll like HCG, they'll like introduce into the uterus before transfer. So there's a theory behind this. They say that since the embryo is like created outside of the body, right, in ART, the embryo is not like in the fallopian tube, triggering your body's like natural release of
Mm,
HCG. So they feel
hmm.
like if they put some in there, you know what I mean, it's going to help improve success. There's also things like you can ask your clinic, like, oh, like, are you using like embryo glue as a medium to try and like increase stickiness? So there's other like little things like you can do too in regard to like what tools like they're using in the lab.
That's so much information. That's amazing that you know all this and that you're sharing all this, but it's a lot, isn't it, to digest and to sort of like
Yeah. And so
for
many people
people.
like don't know that any of these things exist, right? And
No,
that's
I
my thing, is
didn't.
like we need to know that these things exist. So if
Yeah.
you need to start going on the hunt for other providers, or like, there's so many people going to other countries and stuff, it's like, well, if you have this information, you can pick,
Yeah.
the area that you want to go to that offers like more advanced treatments.
So I wanted to ask you about that. So obviously you said also in the email about it being controversial. You sort of talked about a little bit of that in terms of like it's not always heavily tested, or it's, some of the tests are inconclusive. And like you said about travel, so are some of these tests, I don't know if any of them are illegal, but are some of them more prevalent or more, whatever the word is, in certain countries versus other countries? Like, is the US better for something, or Europe, or do you recommend people travel and find, a doctor in Turkey or someone in wherever to sort of find the right person that might do these tests and these treatments?
Yeah, I'd say like Canada and the US in particular is, I think, like a little bit like more advanced, but it depends on the doctor. You know what
Yeah,
I mean? But there are doctors kind of like pushing boundaries and doing more things, I think. And then when you start getting into Europe, it really does depend on the different country, because I see like some countries are doing like more things, like Fertility out of Greece, like they're the ones creating like these amazing
yeah,
microbiome tests. So they're a little bit more into it. But then there's other countries that are like way more conservative,
yeah,
right? And they're just like unwilling to try or do things. The doctor's just like, I don't know, like you just have some doctors that are just really conservative, or, depending on how many years they've been practicing, like, you want that doctor who's been practicing sort of for like a good amount of years. They have a lot of experience under their belt. Like if you're really looking, like you've already kind of been through the ringer, like you want someone who's really experienced, but who's still learning, who's still trying things, who's
yeah,
still hungry. You know what I
yeah.
mean? Where if you get the ones that are maybe close to the end of their career and they've been doing the same exact thing for 30, 40 years, like you don't want that guy.
No,
He's
no,
not, he's just doing, some of these doctors are just doing cookie cutter medicine. And these are my 10 protocols or my 5 protocols that I've been using for these years. This is all I do, and that's it. Well,
yeah.
you don't want that.
This might be a rogue question, but I know it's going to be impossible to answer, so I apologize. But how long do these sort of testing take? So is it something where, for example, you can have online consultations and then fly to the US to get this treatment or this injection and then fly back to wherever you're from? Or is it something more like you're probably going to have to move and be there for 2 years? Obviously, I know it depends on the testing, but generally, what would you sort of suggest?
I mean, I don't think you would have to like move and be there for 2 years. Definitely not. So, I mean, microbiome testing, you can order it to your door. Like I said,
Yeah,
that's something you can do at home on your own. And then if you find doctors that are doing like international consultations, sometimes you can consult with them. You don't have to leave your home. You can do a
Yeah.
virtual consult with them. They may be able to like order you certain things, and then are you able to collaborate with a doctor in your area that's like, yes, I'll order you that medication. Okay, I see the script from this doctor. Yes, I'm willing to do that. I'm willing to
Mm.
order you these antibiotics and these things. Do you live in an area that will help you? Like, can you find a doctor that is willing to collaborate and willing to work? Like we've seen that here, for example, with like satellite monitoring clinics. I myself, I used to work at a place where we would help satellite monitor people that were doing international treatment, and their doctor would like send over their plan and the medications they wanted them on. That person would consult with our doctor, and then our doctor would
Mm.
look through and say, yes, like I am definitely in, I will definitely prescribe, like this makes sense, I'll prescribe A, B, C, and D. Sometimes there might be one or two things that they're like, no, we don't do that. So depending on when they need to take it in their protocol, if it was close enough, then they could just get it there in
Mm.
that country and do it there.
Yeah.
If it worked out. If not, maybe their family doctor would help them, or like another doctor, just depending on like what it is and who can prescribe it. So there's that way of doing it. And then other times it just depends, like, what are you going to do like during your cycle,
Mm.
So can you find a satellite monitoring clinic if you're going to do like a treatment with an international doctor? Can you
Mm.
find a satellite monitoring clinic in your area? We can do a certain amount of testing, certain amount of monitoring, staying home, and then only go to the country you need to go to for a certain portion of time. Is it
Yeah.
just a week? Is it a few days? Is it 2 weeks? Like, or do you need to just be there for one cycle and
Yeah.
stay there? And that's something you can work out. It just depends on the resources you have in your area. And there are
Yeah.
doctors out there willing to work and collaborate and do these things.
So you said that if people have experienced 5 to 6 losses, it's probably an immune issue. So I just wanted to sort of say that again. So if people have experienced 5 to 6 losses, or, well, I guess for like pregnancy losses and recurrent implantation failure, then people probably need to look into immune
Yeah.
conditions. Is
Yeah.
probably
If
what's going on.
yeah, if you're transferring like multiple embryos and it's not working, lots of doctors, if you transfer like over like two to three embryos and it's not working, like the good doctors will start wanting to do biopsies. They're going to start wanting to look into things. But you can definitely, if you haven't had your microbiome checked and you've done two embryo transfers and they haven't taken, I would be asking about biopsies and microbiome testing for sure. They'll also want to do receptivity tests. There's things like the matrix ultrasound, and the ERA test. ERA is a little bit controversial. Some doctors don't like it. Some doctors do. I mean, in the end, it's just another piece of information. If you're, going through embryos and something's not working, I mean, how is more information going to hurt? So that's like, was it receptive? Do we need to alter the progesterone? How many hours, after do we need to transfer the embryo? What's like the good window? So that's what the ERA is, the ERA, looking at that. And then matrix is also a receptivity, like ultrasound that you can do. So, you'll have like your transfer scheduled, but then you'll go for this ultrasound. It's usually like a transvaginal probe ultrasound. And they take a bunch of images and they send it to the matrix company, and they have like specialized technology and algorithms that looks at these
Okay.
pictures and it looks at the morphology of the endometrium, and then they give a score. It's like 0 to 10 on receptivity, and the doctor can look at that score. And usually, if it's like 7 or above, it's like receptive. It looks good.
Yeah.
If it's below, then it's like, oh, the receptivity may not be that good. If it's like 6, maybe that's a conversation to have with the patient. The patient might be like, oh, I'm going to go through with it and everything's going to be fine and it's going
Mm.
to work. But if your receptivity is like 1, you might want to
Yeah.
be like, do I want to go through and transfer this embryo, or do we need to start looking into other things? So it's just like more
Yeah.
information. So that's good testing that you can do too, that can help in cases of recurrent implantation failure. Recurrent losses. Yeah. Like I know lots of doctors that like after 2, like we're running that blood work. We're
Yeah.
running that like in advance, even at like 3. But yeah, when you're getting your chances of like having a good pregnancy, even after like 2, 3, 4, they're still there. Like it's still good. It's increasing.
Okay.
But when you're getting like beyond, like it's like if you're nobody's done any testing or you're just been at home trying and having multiple losses, like no, stop. Like something is going on.
Yeah.
Like serious, you need to get more testing done.
Is age also a factor? Because obviously we always talk about age with women with fertility. So if somebody's experienced 5 or 6 losses and they're early 20s, is there less likely things going on versus if somebody's in their mid to late 30s and they've lost 5 to 6 pregnancies, or is it just even keel, or is age a
Well,
factor really? These sort of things
the
we're talking
cause
about.
could be different. The cause could be different. So, if you're having recurrent pregnancy loss in your 20s, I'd be concerned that like, yeah, like something's going on. Like you have some kind of, do you have like some kind of like APS, some kind of autoimmune, like something in that area? Like I would be like, okay, but you also have to consider, is it a genetic factor too?
Mm,
So, do you have some kind, what's your carrier type? Your karyotype, have you had carrier screening? Are you and your partner together like contributing a gene that's causing an issue?
mm,
So looking at in the early 20s, like I would look at the same things no matter what the age, but I would also consider as you age, there's a higher risk for chromosomal abnormalities. And usually, when you're seeing losses like in the first trimester, that's usually like that's what people think of right away. Like at the first one or two, they're like, oh, well, like maybe just chromosomally, like something was wrong. It just wasn't good.
yeah,
But that doesn't mean you
yeah,
can't go on to have like a healthy pregnancy. But like as we age, just that risk gets higher and higher and higher
yeah.
for an abnormality. So I feel like that's where like age really plays into it.
Okay. This is a lot of information. It's amazing. Is there anything else you want to add that we've sort of not touched on yet and that you want to sort of include in this conversation as well?
I mean, I don't know if I can say anymore right now. I mean, I said a lot. Do you want me to say anymore?
I
You're
mean, if
like,
there's
no,
anything
no more.
else you want to add, of course, but like this is amazing already and it's a lot and it's, I'm sure people are at home like taking notes and writing things down and, question like Googling things and finding out if their doctor does this or that and the other. So it's already been incredible, but yeah, amazing. I just want to ask you about myStoria. So is it that you're based in Canada or that myStoria is also based in Canada? And then along with that, do you help people just from Canada or can you help people from all around the world or how does that work?
So, myStoria. So we are a company out of Canada. So I'm
Hmm.
based in Ontario, Canada, but we are like our platform is available to people in Canada and the US right now.
Okay.
So this helps you sort of solve the problem of like tracking your fertility journey. It's like you can upload and sort your medical records. I can do that for you. You're tracking your journey all in one area. You're getting educational information. You're answering questions and doing assessments that can help you like dig into root causes. I'm the head of the concierge department there, so I
Hmm.
can help you like with all of this stuff. So, when you're answering the questions and uploading your documents, you can book an appointment with me and I can look through your stuff. And then this is the kind of thing, right? Is like
Yeah.
what we're talking about is I would see and be like, have you had this testing done? Advocate for this, ask for this. Like this is what we do, right? And
Yeah.
you can, receive support through your entire journey, but even through like pregnancy as well.
Mm.
Like I want to continue to support women through their health journey. And it's so much easier when you have your stuff all in one area, really,
Yeah.
because then if you're like, oh, I want to up and go and connect with this doctor, you have all your records, you can give them yourself. You don't have to wait like, 3 months for your clinic
Yeah.
to send records, and they're just really holding up your journey, which is frustrating. And you can start to pick up on like your own trends as
Yeah.
well. And learn so much more. This is like we like the hub, like one stop shop, and we're just getting more resources, getting better, and going to do more things over time. So yeah, the platform isn't available for people outside the Canada, the US yet to be members, but I always encourage people, if you need help or you just have a simple question, like you could always like reach out to me on
Yeah.
Instagram. Like I'm always there. I can't get like obviously like as in depth as I would on myStoria, but I've helped people and helped them answer their questions all the time. I mean, that's what we're there is to get this information out in the community, and we all need to support each other and lift each other up, and we need to collaborate, not compete.
Yeah. Exactly.
Yeah.
I know my story is amazing because they have you.
Oh,
The
thank
amount of
you.
knowledge that is in that head of yours is insane. So like you just have so much information and you're so good at talking about it and sort of relaying that information and making it understandable. And like I can ask stupid questions and it's not stupid. Like you're so good at this. I mean, I know you've been doing it 15
Thank
years,
you.
so obviously you're good at your job. But like I know that if my story was hired you, like they're going to be incredible as well because the amount of knowledge that you have, and if there's more people on the team, like yeah, amazing. I will leave the myStoria website and your Instagram and everything else in the description box below. I'll also leave the video that we did last time, and I'll leave a downloadable file thing that people can download with all of this information and websites to the vitamins that you said for men and the boxers, the underwear, and all the testing and everything. You need to send me a big old email with everything so I can
Okay,
leave
I
it
will. I
all
will.
in the YouTube description so everyone can go and find everything. But thank you again so much for coming on and for sharing so much knowledge. It's so valuable to be able to share this and to speak to somebody who just knows so much and also, like you said, is pushing forwards and wanting to learn more and do better and find out all these research studies. So honestly, I think you're amazing. I think what you're doing is incredible. So yeah, thank you. Thanks.
Thank you. Thank you so much for having me. It was great talking with you again.
Yeah, thank you so much.